would like to introduce you to the WHO experts who will be given answers to your questions. In the WHO studio in Copenhagen, we have the regional director of the WHO Euro, Dr. Hans Kluge. Next to him, you can see Dr. Igor Perginets, who is the acting program area manager, country health emergency preparedness and IHR. And also Dr. Oleg Benish, the chief expert on immunization of the WHO Euro. We will have only 1 hour for this briefing, so without any further ado, I would like to give the floor to Dr. Kluge, our regional director.
Вакцини ведут нас к миру без угрозы
to the world without the threat of antibiotic resistance. The fact that the countries of the European region on average reached 96% of children scheduled to receive their first dose of measles vaccines in 2019 is testament to the commitment of governments in the region to eliminate measles. We now need that commitment to vaccinating against SARS-CoV-2 virus. My message today goes beyond COVID-19. 2019 saw the result of faltering immunization rates in previous years in the form of more than 100,000 measles cases. And when routine immunization services are temporarily interrupted, as was the case precisely a year ago in 6 countries in the region hard hit by the pandemic, that interruption may lead to infectious disease outbreaks further down the line. Hard-earned success can slip away fast. That is why I urge you to press hard to maintain high immunization coverage with the routine vaccines in the region. We must not loosen our grip on vaccine-preventable diseases. And we are to keep the upper hand. Health systems need to provide essential primary health care, including routine vaccination, while controlling the epidemic. Once again, vaccines are about to change the course of history, but only if we act responsibly and get vaccinated when offered the opportunity to do so. Vaccines are a tool of no use when sitting on the shelves in cold rooms, but life-saving when injected in people's arms. Ultimately, it is us, the people who receive them, who make them work for the good of all. Thank you. Thank you, Dr. Kluge. Dear colleague, now I would like to start the question and session. I would like to thank the journalists who sent their questions in advance. We will combine questions in writing and online to give an opportunity to everybody to ask their questions.
So the question from Irina Nevinna from the Russian paper. Let me please read it out. Irina asks you to tell about the information WHO currently has on the Indian strain of coronavirus. How true is the information that existing vaccines will not protect against this variant of the virus, and that people might get reinfected even if they had already had the disease? And there is an additional question. Has this variant been recorded in Europe, and what is the threat of its spread? I would like to give the floor to Dr. Kluge. Dr. Kluge, please, could you please comment on it?
Thank you. Thank you, Olga.
Hans, should I repeat in English for you?
No, everything is clear.
Okay.
So, the B1617, initially identified in India, has been added now as a variant of interest by WHO, with a number of countries in the European region seeing the transmission. Dear colleagues, I think it's very important to realize that the situation in India can happen anywhere. This is still a huge challenge in the countries. When personal protective measures are being relaxed, when there are mass gatherings, when there are more contagious variants, and the vaccination coverage is still low, this can basically create a perfect storm in any country. But it is never too late. I'm also in constant touch with my colleague, Dr. Poonam Singh, the Region Director of the Southeastern European region. I would like to congratulate her for her leadership. And the solidarity is very important. We have seen a lot of solidarity currently. For example, the Russian Ministry of Foreign Affairs will send to India an urgent flight with a large consignment of aid that includes oxygen concentrators, artificial lung ventilation devices, anti-COVID drugs, and other medical and medicinal products. The same for the European Union. Romania is sending emergency medical teams, etc. The effectiveness of the vaccine, I will pass to my colleagues, but this is very much being studied as if we speak. Thank you.
Большое спасибо, доктор Клюге.
Thank you very much, Dr. Kluge. Dr. Perichinets, would you like to add a few words about the situation on the spread of this variant in Europe? Thank you very much for this question. You're absolutely right. The variant circulating in India has been identified, has been detected first in December, B1617, and it is circulated alongside other variants. As Dr. Kluge has said, the situation might really cause a perfect storm when circulation of the virus and mass gatherings which took place in India right before this surge is the result of what we see right now. The increase in number of cases, about 2 million have been recorded recently, and more than 15,000 deaths. At this stage, the WHO is classifying this variant as the variant of interest, as it is still under investigation. And WHO scientists and researchers are still looking into it. We know that there are 2 mutations which have occurred in this particular variant, and they might negate the efficacy of mononuclear antibodies used for the treatment, and they also might neutralize antibodies, which have people who have had COVID, they recovered after recovering from COVID-19. But this research is still undergoing, and therefore we cannot have undoubtedly say whether these particular mutations are responsible for this upsurge in cases, or there might be other factors related to that. And we know that public health measures are really important, and personal protective measures are really important. We know that right before the surge, there had been multiple mass gatherings and election taking place. And those events might have resulted in closer contacts than those recommended by the World Health Organization. Therefore, right now we classify this particular variant as the variant of interest. If we get additional data saying that this particular variant affects the course of the disease or changes the clinical presentation of the virus, it might be reclassified as the variant of concern. But right now, we would like to draw your attention to that the key elements of preventing such disasters is proper implementation of all public health measures and personal protective measures. Answering the second part of your question, whether it has been detected in Europe, yes, more than 10 countries in Europe have detected this variant using viral sequencing in their labs. And the global influenza monitoring system, which is now also used to identify various variants, has encountered more than 100 cases of detection of this particular variant of interest. The majority of information, the most part, comes from the Great Britain. Therefore, you shouldn't be afraid that the spread of this variant will really happen. We can prevent it in time, and we should say that public health measures should continue to be used. Immunization should go on, because these are really effective measures. And even despite the fact that we have pretty active vaccination rates, we shouldn't take the vaccination coverage as the reason for complacency or some lifting of the restrictions. Quite the opposite. We should stick to all the measures. These measures have already confirmed its efficacy, And this is a way for us to fight with the clinical cases. Thank you, Dr. Pereginets. Dr. Benesh, maybe you would like to add a few words about the efficacy of vaccines against this new variant. Thank you very much. Speaking about the efficacy of vaccines, it's very important to speak about efficacy based on evidence. And right now, we have no evidence that these vaccines are not effective against this virus. So the research has not been performed. We need to have this research. What do we know? The data available for the World Health Organization is that existing vaccines are effective against the majority of circulating variants of this virus. And the most important thing is that they are effective in preventive severe cases of COVID. They prevent hospitalization and mortality. But the World Health Organization pays serious attention to the issue of circulating variants and their possible escape from vaccines. And therefore, the World Health Organization collaborates with manufacturers and scientific community in order to look into the possibility of adaptation of the vaccines if necessary. Thank you very much. Now we are ready to accept questions from the journalists. I would like to remind you that to ask a question, please use the raise hand function in Zoom.
Для того, чтобы задать вопрос,
in order to ask a question, could you please raise your hand? Thank you. I see a question from Jacob, but I don't see the name of the mass media outlet you represent. Could you please introduce yourself?
Hello, can you hear me okay? Can you hear me?
Hello, yes, we can hear you.
Hi, Jacob Peterson from Reuters. Just a question about the rollout of vaccines in Europe. Hans Kluge, a month ago or so, you were quite harsh in your critique, saying it was unacceptably slow, I believe. What's your impression of it now? Has it improved, and why not? What's lacking at this point in the rollout? Thank you.
Большое спасибо за вопрос.
Thank you very much for your question. As this pertains to the allocation of vaccines in WHO European region, I believe it to be reasonable to address it to Dr. Benesh.
Thank you, Jakob, for your question. What we can see at this stage is that countries have very actively engaged in organizing vaccination against COVID. And we were looking at vaccine utilization rate. So looking at doses which countries have received and doses which countries have been administered. And that rate is very high. It is about 85%. Some countries which have been at the beginning of the process were a little bit slower, but then in a couple of weeks they speed up in terms of vaccine implementation. So one of the overarching issue, global issue at this stage is access to enough vaccine doses, access to vaccine supply. And we are aware of tremendous efforts globally and regionally to expand vaccine production and improve access, but it's an issue, and still countries have to act in a very wise manner and using rationally those doses which can be accessed. that means that focusing on priority groups and vaccinated those who need it most at this stage. Over.
Уважаемый Олег, большое спасибо. И позвольте
Dear
мне...
Oleg, thank you very much. And at that, I would like to give the mic to Dr. Hans Kluge, our regional director.
Jacob, for the question. So what was the core of my message? That now we have a life-saving tool which makes COVID-19 a preventable disease. So absolutely all the efforts have to be joined to drastically accelerate the rollout of the vaccination. This was not a criticism to anyone, but an appeal for looking pan-European and of course globally as well, that we don't have a divide in our region of countries, right, moving to very high coverage rates, while in other countries of our pan-European region, we still struggle to vaccinate healthcare workers and the vulnerable people. Do I see a difference? Absolutely, I see a difference. Many initiatives are being accelerated, including by the European Commission, right, to beef up drastically the production capacity, because that's some conditio sine qua non. Then also several countries now started to share vaccines once that they reach a threshold of about 20%. I myself, last week, I was on an uninterrupted 10-day intensive country duty travel to Greece, Serbia, Hungary, and I met Prime Minister Mitsotakis, I met President Vučić in Serbia, I met Prime Minister Viktor Orban in Hungary, and I made the point everywhere, and this was very, very welcome received, and there is an understanding really. Then we saw the announcement by the European Commission, and I was in touch even this morning with the Minister of Foreign Affairs of Austria, Minister Schallenberg, of donations from the EU, coordinated by Austria to the West Balkan. We're also scaling up the procedure for WHO emergency use listing of the Sputnik V vaccine, for example, in the Russian Federation, because that's something else which needs to be done. We need a larger portfolio of vaccines, but also we need, Jacob, to work on vaccine hesitancy, because in a number of countries, we do see that once that a certain percentage of the population is reached, that we should engage the communities much more around the life-saving effect of the vaccine. So it was definitely, and also I want to clarify that I was not speaking about the Europe in terms of EU. When I speak about the European region, I always speak about the 50 member states. So it was a call for action, but definitely there's a positive dynamics, but we have to be more feverish. One thing that we have to anticipate also, Jacob, is that we know that the European Union countries have not opted out of the contracts, which means that in a number of months, we may anticipate maybe a surplus. At that moment, we have to be ready with mechanisms for donation and reselling. Thank you.
Большое спасибо, доктор Клюге.
Could I ask a follow-up question on that? Sorry. Is that
Jakob, sorry.
Could I ask another question, please?
Please, briefly, if possible. Thank you.
Okay, just to follow up on the last bit. We know that AstraZeneca is under less pressure to deliver vaccines in the future, because some countries and regions have said they're going for other options. So I'd be interested to know whether WHO is negotiating with AstraZeneca to use their vaccines for the COVAX rollout in poorer countries, possibly.
Спасибо за дополнение к вопросу. Доктор Клюге, вы хотели бы прокомментировать?
Thank you very much for the addition of this question. Dr. Kluge, would you like to comment on it?
I will kickstart the reply and then hand over to my colleague Oleg to go more in detail. Actually, today there is a workshop by the Danish Health Authority together with Norway also on this issue, and we ourselves, we had the SAGE, the ETAGE, the Technical Advisory Group. So you were mentioning poor countries, but you know, WHO recommendation is we don't look it from that perspective. Our recommendation on the evidence available is that the benefits of the AstraZeneca by far outweighs the risks, and that the risk to have a blood clot from COVID-19 infection today is much higher than the risk of having a blood clot from the AstraZeneca vaccine. So in that sense, the global recommendation is definitely still to use the AstraZeneca vaccine. Of course, every country decides on itself, depending on vaccine availability, on epidemiology, etc. Recently, I was asked whether I would take the AstraZeneca vaccine. I'm here in Denmark, so it's not my turn yet. I'm in the age group between 50 and 55 and healthy. But if tomorrow I get a message to take the AstraZeneca vaccine, I will not hesitate a second. Thank you.
Доктор Клюге, большое спасибо. Доктор Олег Бениш, вы хотели бы дополнить?
Dr. Kluge, thank you very much. Dr. Benish, would you like to add something?
Yes, thank you, Jakob, for this question. I just would like to emphasize that, again, looking at the context in terms of vaccine supply, AstraZeneca vaccine remains an essential tool to support vaccination response. And the benefits of preventing disease and deaths are far outweighing the risks related to very rare side effects. And from this perspective, WHO has a very clear standpoint, which was supported by the Strategic Advisory Group of Experts on Immunization, by the Global Committee on Vaccine Safety, and the same position is shared by almost all countries in the region, including national drugs regulatory authorities and programs. And I also would like to emphasize that AstraZeneca vaccine is used by majority of member states of WHO Europe member states. We know that some countries took some decisions on recommending or restricting use of this vaccine to particular groups. As of yesterday, we had a meeting of the European Technical Advisory Group of Experts in Immunization to review all the issues and challenges related to the decision-making on how to make best use of AstraZeneca vaccine and to provide guidance to countries. And it's very clear that each country, when they take a decision of limiting the use or of recommending the use of AstraZeneca to particular groups, they have to take into account many more elements, again, making sure that the decision of limiting the use of this vaccine would not result in increased risks because of COVID disease. Thank you.
Доктор Бениш, большое спасибо за ваш ответ. И также, чтобы продолжить тему, связанную с вакциной AstraZeneca.
So to continue the topic of AstraZeneca vaccine, I would like to read a question which you received earlier from Rima Garibyan, who represents the Java-Hit Information Center. Her question is the following. In March 2021, after another research, WHO said that the connection between thrombosis and vaccination with AstraZeneca was not established. But in April, WHO declared that this connection is possible. Why did that happen? What group has the most risk while being vaccinated with AstraZeneca? Could you please comment on it? Thank you very much for the question. First of all, I would like to know that monitoring of vaccine safety is an ongoing process. It starts on the stage of vaccine development, then continues during the clinical trials, and then later on, after vaccines are being implemented into practice. The detection of some rare possible reactions, such as anaphylactic shock, is possible only after the rollout of vaccines, because these cases are very rare. The same situation is relative to thrombosis associated with thrombocytopenia. Only after that vaccine was used in about 20 million people, the systems for monitoring the safety of vaccines showed that some new cases and conditions occurred, and their frequency was higher than we expected in the population. And so the first meeting in March, and that was the meeting of the Vaccine Safety Committee, was based on the primary information available for that vaccine. And as Dr. Kluge said, the condition of thrombosis associated with thrombocytopenia is quite frequent in patients with COVID-19. And so we had lots of questions about the association of COVID and thrombosis frequent. After the generation of data, after some additional clinical trials, a number of regulatory bodies such as EMA and medical agency in UK updated the information on this vaccine. And based on that, the subcommittee of the WHO was able to update its own information as well. We also needed to analyze the frequency of these cases and conditions in the world, because the first signal in March was based on the signals from the European countries. By April, we started receiving the information on these cases and conditions in other countries as well. We also got the reports, similar reports, that were related to other vaccines. This situation is very dynamic, but WHO continues monitoring the situations and always updates its information. Thank you very much for your reply, Oleg. And now I would like to give the floor to Natalia Segura, who represents the Information Agency of Catalonia. Natalia, пожалуйста, the floor is yours.
Hello, good morning. Do you hear me?
Yes, we can hear you.
Okay, good. I would like to ask two questions on two different subjects. First of all, the CDC in the US has recommended the use of vaccines, Pfizer and Moderna vaccines for pregnant women. So I was wondering if WHO is thinking about reviewing this and changing its recommendations regarding the use of vaccines for pregnant women. And the second question is about AstraZeneca. You just say, like, you recommend the use of AstraZeneca for all adults, as the EMA does, but there are currently governments like the Spanish one that are trying to decide whether to give the second dose of AstraZeneca to those under 60 that have received the first one. So I wonder if do you think that this is like contributing to the hesitancy of vaccination, as these vaccines are actually recommended for adults. So I would like to know your opinion on this. Thank you very much.
Большое спасибо за ваш вопрос. Доктор Олег Бениш.
Thank you very much for your question. Dr. Oleg Benish, could you please give an answer?
Thank you, Natalia, for your questions. When it comes to vaccine recommendations, there are two aspects. Normally, vaccine recommendations are based on studies, based on conducted clinical trials and results from those trials. And during clinical trials, we have to have enough people observed in order to make a judgment. Pregnant women were not part of clinical trials of COVID vaccines. And there is also an ethical consideration behind that. So that's mainly the core cause of not having vaccination recommended for pregnant women. From the other side, we also are aware of the real life experience, and we know that many women might have received vaccine because they were not aware of the pregnancy status. And the data so far do not indicate towards any specific added risk to pregnant women. And also looking at scientific concerns, we also cannot identify too many risks. So therefore, when Global Advisory Group of experts on immunization reviewed this topic, they clearly indicated that in pregnancy, vaccination shall be considered based on risk analysis. For example, if a pregnant woman has a very high risk of acquiring COVID-19 disease, then it's worth to consider vaccination. That was first part of your question. And regarding the second part of your question, which is mainly about defining specific subgroups of population for which vaccination is recommended now by some countries in the region. Again, there is a lot of ongoing research and on potential risk factors for developing cases of thrombosis and thrombocytopenia, because that's what matters. We need to know what are those factors which can increase the likelihood of getting such a condition. At this stage, because of the number of such cases, again, is very limited, there is not a clear conclusion yet drawn on potential risk factors. So that it's very difficult to base your decisions on recommending the vaccine only to particular groups. It's an ongoing work, and the situation will be updated. Again, as I said, as of yesterday, European Technical Advisory Group reviewed again the situation, and we will come up with more guidance to countries on how to base decisions on evidence and data, and making sure that we do not actually bring more harm by limiting the use of the vaccine, because of leaving people exposed to COVID disease.
Уважаемый Олег, большое спасибо за ваш ответ. У нас уже остается достаточно мало времени.
Oleg, thank you very much for your answer. We have very limited time left. I would like to read out a question we received ahead of time, and it pertains to the Russian Federation. We received it from Daria Litvinova, who represents Associated Press in Moscow, and it goes as follows. What is your take on the vaccination rate in Russia, where only over 12 million people, or 8% of the population, have received at least one dose of COVID-19 vaccine? Why do you think the immunization campaign in Russia is so slow? I believe that, Oleg, it's a question to you.
Дарья, в первую очередь я хотел бы обратить внимание, что
First and foremost, I would like to draw your attention to the fact that vaccination and the fight with the SARS-CoV-2 virus is not a competition between countries. It's very important for all of us to ensure reduction of the impact of this virus. And it's important for each and every country. There cannot be any separate, isolated success. Success is possible only if there is solidarity and all of us work together in a particular situation. The success of the vaccination against COVID-19 depends on three major groups of factors. First is the access to vaccines, and we know that globally there is a problem of access to vaccines. Another important factor, as rightfully mentioned by Dr. Kluge, is the factor associated with the demand for vaccines and the acceptance of vaccines by the population. And the third factor is the infrastructure and the services in order to deliver vaccination, which will allow us to do it rationally and use the available dosages in a rational way. There are some reserves in the region. We have not finished the vaccination of the risk groups. Therefore, we should first and foremost focus on protecting those who need it the most. And then we can start thinking about scaling up the coverage and vaccinating other groups of population when we get additional access to additional doses. Alex, thank you very much, and I'm sorry for interrupting you. We have just a few minutes left before the end of the briefing. Therefore, I would like to ask Dr. Kluge if you'd like to have any final words. Thank you, Olga. Today we celebrate the 10th anniversary of the first global ministerial conference on healthy lifestyles and non-communicable diseases, which took place in Moscow in 2011. It's very important to know that because the Moscow Declaration was adopted, which was adopted as the outcome of the conference, was the first, for the first time highlighted the priority of fighting non-communicable diseases on a global scale, and it gave impetus to the promotion of healthy lifestyles and disease prevention, and a change in the paradigm of global health development. That call was heard and supported not only by the World Health Organization, but also by the UN member states, which in September the same year at the UN General Assembly in New York adopted a political declaration on combating NCDs. Since then, the countries of the WHO European region have been actively in the fight against non-communicable diseases. And here I would like to emphasize the role of the Russian Federation and the WHO NCD office in Moscow. This office is the Global Excellence Center, and it shows a very nice collaboration on primary health care. And we also collaborate with the primary health care office in Almaty. COVID-19 measures must be responsive to the context of non-communicable diseases and should take into account the important role of primary health care. And doing so, we are really implementing the principles of leaving no one behind. Dr. Kluge, thank you very much. At that, let us close our press briefing for today. It just remains for me to thank our panelists. Thank you, Regional Director, Dr. Pirhinets, Dr. Benesh. Thank all of you who has called in and followed this press briefing online. Thank you for your questions. If we have not managed to answer some of your questions, please send them to us using the email you received in the invitation. We would like to wish you to stay healthy and take care. Looking forward to seeing you again. Have a nice day. Goodbye.